Welcome to the MediByte channel. As a healthcare professional, I totally get that hearing medical terminology can sometimes feel, a bit overwhelming. But we're here to break down those complex medical topics into empowering explainers. Today, we're unpacking a term you've probably heard thrown around in the doctor's office. We're talking about what a high-risk pregnancy really means.
So right off the bat, I want to ask you, what actually makes a pregnancy high risk? I mean, it sounds super alarming, right? But I want to ease those fears for you right out of the gate. We really shouldn't frame this medical classification as some immediate tragedy. Instead, look at it as a vital tool for better care. It's literally just a way for healthcare providers to say, hey, we need to keep a closer eye on you to make sure everything goes perfectly.
Okay, here is the agenda for our journey today. We're going to cover 6 key sections. Section 1, defining high-risk pregnancy. Section 2, key pregnancy risk factors. Section 3, understanding maternal mortality. Section 4, maternal death causes. Section 5, perinatal mortality and newborns. And finally, Section 6, empowering health and prevention.
Let's dive right into Section 1, defining high-risk pregnancy.
So what does this medical classification actually mean for expectant parents from a clinical standpoint? Well, a high-risk pregnancy is defined as a pregnancy where medical conditions or other health issues in the mother, the fetus, or the baby increase the risk of becoming ill before, during, or after delivery. Identifying this early, it's a massive advantage. It allows healthcare teams to proactively manage risks rather than just, reacting to emergencies. As part of routine care, doctors check for these factors to provide tailored, specialized medical care. And for some prospective parents, this early identification means a genetic evaluation is highly advisable. That gives doctors a chance to assess family history or analyze blood samples to check for hereditary genetic disorders long before they ever become an issue.
Moving on to Section 2, key pregnancy risk factors. Now that we know what the term means, what are the specific factors doctors are actually looking at to determine a pregnancy's level of risk? Well, it's a real mix of things. We look at physical characteristics like the mother's age and weight. We look at problems during previous pregnancies or complications that might have developed during past labor and deliveries. Crucially, pre-existing disorders, meaning things you had before getting pregnant, like chronic high blood pressure, diabetes, sexually transmitted infections, or kidney infections, those will automatically bump you into a high-risk category. The exact same goes for disorders that develop during the pregnancy itself, like gestational diabetes or preeclampsia, which is a really dangerous high blood pressure condition, as well as any exposure to harmful substances. Evaluating all these factors is basically step 1 in building a comprehensive care plan.
Which brings us to Section 3, understanding maternal mortality.
I want to transition gently into this sobering reality, but we're framing this data as absolutely crucial context for why the proactive monitoring we just talked about matters so deeply. Before we get into the statistics, let's just clarify the distinction between maternal and perinatal mortality so we're all on the same page. Maternal mortality is the death of a pregnant woman caused by complications of pregnancy or childbirth. Perinatal mortality, on the other hand, which we'll get into a bit later, refers to the death of a fetus or newborn around the time of delivery. Getting these definitions straight helps us pinpoint exactly where healthcare systems need to improve.
To put this into a global context, when we compare maternal mortality ratios, which represent deaths per 100,000 live births in 2020, we see a pretty massive range. Poland sits all the way down at 2, Germany is at 4, the UK at 10, the US at 21, and Mexico at 59. While the US rate is noticeably higher than many European countries, the source data also points out that the most severe rates globally occur in low-resource countries, specifically in places like Sub-Saharan Africa and South Asia. Understanding this global picture really hits the nail on the head. The quality of and access to healthcare completely dictates these outcomes.
Now, what highlights a significant challenge in public health is how these numbers break down internally. In the US for 2021, the rate was about 70 for non-Hispanic Black women. Compare that to 28 for Hispanic women and almost 27 for non-Hispanic white women. That is a staggering difference, and the data shows similar disparities exist globally too. For example, in Brazil, maternal mortality is about 5 times higher in women of African descent than white women. In the UK, it's also more than 5 times higher for Black women. These statistics emphasize exactly why systemic healthcare equity is so absolutely critical worldwide. It's not just about having the medical tech, it's about making sure every single person actually gets the same standard of care.
Let's break down when these tragedies actually occur, because the timing might really surprise you. 25% happen before delivery, and another 25% happen during or right after delivery. But check this out. 30% occur later after delivery, and 20% happen more than 42 days, up to a full year later. Think about that. Half of all maternal deaths happen after the delivery is completely over. This proves exactly why extended, rigorous postpartum care is just absolutely critical. We can't simply stop monitoring once the baby is born. The mother's health remains really delicate for months.
Let's look at Section 4, maternal death causes. We need to understand the specific medical reasons, and honestly, the systemic barriers driving these mortality numbers. The most common cause of death in pregnant women is severe bleeding, or hemorrhage, which accounts for over a fourth of deaths. Other major medical causes include high blood pressure and preeclampsia, ectopic pregnancies, which is when a fertilized egg grows outside the uterus, and sepsis, which is a severe life-threatening response to an infection. Complications of labor and delivery and pulmonary embolisms also play a major role here. But beyond the strictly medical conditions, systemic problems greatly exacerbate these risks. Delays in seeking medical care, a simple lack of transportation to a healthcare facility, and delays in receiving care once you actually get to the facility. These are all huge contributing factors.
Section 5, perinatal mortality and newborns.
Transitioning now, let's shift our focus to the health of the fetus and the newborn around the time of delivery, 5.5. That is the specific perinatal mortality rate per 1,000 live births in the United States for the year 2021. This single number carries immense clinical and emotional weight. It's important to note that the statistic encompasses both stillbirths, which can be related to complex issues with the fetus, the woman, or the placenta, and neonatal deaths. Behind every fraction of a percentage point are real families, and that is exactly why prenatal screening and intervention are prioritized so heavily in high-risk cases.
Tragically, racial disparities affect perinatal mortality as well. In 2021, U.S. rates were 5 for children of non-Hispanic white women, 5 for children of Hispanic women, and jumping all the way to 9 for children of non-Hispanic Black women. These numbers directly mirror the disparities we just saw in maternal mortality. It just strongly reinforces the urgent need for comprehensive community health initiatives that support families of color before, during, and after pregnancy. When we look specifically at neonatal deaths, which, by the way, is defined as the death of a baby in the first 28 days of life, the vast majority, 75%, happen in that hypercritical first week after birth. Worldwide, these early losses are heavily driven by preterm birth, childbirth-related complications like birth asphyxia, infections, and severe birth defects. This shows us exactly why having top-tier neonatal intensive care units available for high-risk deliveries isn't just a nice-to-have, it's an absolute necessity.
Finally, Section 6, empowering health and prevention. I want to pivot away from the difficult statistics for a second and focus on the most crucial, empowering takeaway of this entire explainer. Approximately 4 out of 5 maternal deaths are preventable. Let that vital statistic really sink in for a moment. 80% of these tragedies do not have to happen. This is the ultimate reason why identifying high-risk pregnancies early is a literal lifesaver. When we know the risks ahead of time, we can take proactive, precise action to protect both the parent and the child.
And taking action, well, that means getting the right support. High-risk pregnancies must be closely monitored. They require specialized care, often involving expert obstetricians and hospital environments specifically equipped to handle complex deliveries. We really want to remind expectant parents that early monitoring and swift medical action are the exact solutions that turn high-risk situations into safe, healthy deliveries. It's all about building a robust safety net so that potential complications are managed long before they ever become emergencies.
Knowing that 4 out of 5 of these maternal deaths are entirely preventable, we really have to ask ourselves, are we doing enough to close the healthcare gap and protect every parent and child? It's a huge question about systemic healthcare improvements, access to care, and medical equity that we all need to be thinking deeply about. The solutions are out there, for sure, but they require serious dedication and resources to make sure they reach everyone.
Well, thank you so much for joining me for this explainer. Our goal is always to empower you with direct, clear medical knowledge. If you found this information valuable today, please like, share, and subscribe to the MediByte channel. We've got lots more empowering public health explainers coming your way. Until next time, stay informed and stay healthy.